You're busy, you've got a decent practice, but nobody wants to be decent. You want to be great, and you want to have a great practice. So how did the most productive, profitable dentist in the nation balance real life, work, and profits, and somehow make it all seem fun? Well, it comes down to simple, everyday practices. So grab a lunch, join us as we chat with top clinicians and influencers to discover their formula for uncommon success. Are you ready? Then it's time to explore everyday practices.
So I think that's where a lot of mistakes happen. I see a lot of mistakes happening that way. One of the hats that I wear that I'm not real happy about wearing, and I've worn it for a long time now, is I'm the chair of peer review for this part of the country. So I get all the complaints and I have to mediate them. And, sometimes you're not popular with those things. But I've learned through all my years of being chair of peer review that so many of these pitfalls that dentists that we make because we didn't really listen to the patient. If we would have just listened to what they really wanted or what they were really striving for, then the whole treatment could have gone a different direction and we wouldn't be in that situation of peer review where we would be at that moment. So that book really opened my eyes to a lot of things. And this happened like before I even went into dental school. So I was reading this book all through dental school. Like I said, I'm still reading it now. There's still some great quotes that I love. One of my favorite quotes, he says, this is really funny, we can all relate to, but he says, we must know when we need to move on. And there's a lot to be said for that too,
Sure.
A lot of different situations that can apply to in a dental practice. So, and one of the funny quotes is, he says, "Oh, I hear you never practice." And, that relates to us, if we never did CE or study, the most successful dentists are the perpetual students, we all know that.
Well, when I hear Dr. Howard Ferran talk about, he says, some dentists will say, I've been doing this for 20 years. And I believe it's him that says this, but he's like, yeah, but if you've been doing it the same way for 20 years, you've been in essence repeating your first year 20 times, not getting 20 years better.
Right.
I always thought that was really interesting.
Yeah, I love him, by the way. I think he is so entertaining. He's somebody that keeps my interest, and I follow him on Instagram. I think his posts are hilarious.
Yes.
I really like him a lot. But I know that there was like I'm probably going to screw this up, but there's that Dalai Lama quote too that talks about that when you talk, you're only repeating what you already know. But if you listen, you may learn something new.
Sure.
So I like that quote too.
Well, what I like about this book that you mentioned, you said, students read this all the time, and probably everyone knows this book. And here, little old me across the river from you in Iowa, I've never heard of this book. And so I'm hoping someday that they can bring it on a horseback or something like that to little old Iowa. So
I'll
we could
send you one.
Oh, no. I'm just saying, like, hopefully one day we'll get it. And you're saying that it's like a textbook for sixth graders, and I'm just like, shoot, I've never even heard of this thing.
It's so good. It's so good. It's just, and every page is so, I relate to all of it. And I don't just relate to it, just me. I mean, as a dentist, I just relate to what I do, my practice. And, we have so many hats in a dental practice. We're accountants, we're CEOs, we're dentists, we're friends, so there's so many different roles we play all day long throughout the day, and the roles change by the minute depending on which way you're turning your back. And so there's just so much to be said for this book. I like it because I can just relate to every single page. I really enjoy it, and like I said, I'd love to meet the author one day because I would really love for him to know like how much it's meant to me over all these decades. So I make my staff read it. I bought copies for them, and I always, you need to read this book. So I'll do that to you. I'll get your own shoot chat. I'll send it to you. So it's good.
I want to hold you to you. Are you going to, is the author still alive?
Yeah. I don't even know. I've never really Googled him. His name is Peter Goldsworthy. I know that because I look it up when I purchase it sometimes. I wonder, I should find that out.
It would be, I can tell you from personal experience, sometimes you reach out and they may seem like very famous people, and how could they possibly respond? And people have responded to me. So you might just make somebody's day, letting him know how much your life has been influenced by this.
He's an Australian writer and medical practitioner, age 68, in Minleton, Australia.
Australia.
Road trip.
Road trip.
You know what? We should do a podcast with him. That would be awesome.
Yeah.
You guys should interview him. That'd be
With
really
the
cool.
maestro.
Yeah.
You two need to just head out to Melbourne in January when PDA is there. Well, we'll
Right.
be there, so you can all connect with David O'Malley and invite this lovely gentleman to just show up and be there. Tanya, I did my best to be very quiet. I wanted to hear what you were saying because it was to say it's gold is an understatement. Dr. Bruce really believes in the power of listening to people. It's one of his golden rules, and so I've had the honor of hearing that for almost a decade now. And before we started recording, everybody, we were talking about Mr. Rogers, and I heard that coming through your voice as you were talking about listening to people. And Mr. Rogers used to always say, "I like you just the way you are."
Right.
It's happened to me a lot, and my failure bout is I get so caught up in the doing. I think, I assume, or I take that next leap because I'm a high action-oriented person that I'm just going to do what I think that person wants. Because of course that's what they want. I'm an expert in this field. They must want it this way. And sometimes in my life I have forgotten to listen and slow down and ask those questions. And you just blew my mind. I didn't even realize that people would come in asking for a specific shade of teeth or thinking that they want a specific shade. I would want whatever the whitest is too, right? I want white teeth.
They think, yes.
Well, that's what I would think as a layman. I'd be like, give me the whitest teeth. If you're giving me veneers, which I call a boob job for your face, by the way, give me the best. So it takes somebody listening, right, to show me and hear what it is that I'm shooting for, and then take the time to educate me as a patient to walk through that. So I think that that's phenomenal that you do that.
Dr. Tanya,
yeah.
how do you think that would market dental boob jobs on a big billboard?
Yeah, that's funny. I've never heard that.
No.
Get your centrals bulked up.
Me a lot. My husband is sometimes he's just mean. I like want to hit him over the head. He says that we spend collectively, cosmetic dentists, we spend our career doing things that don't need to be done. He says that to people. I'm like, that is so mean. They do need to be done. It helps your self-esteem and your confidence. So he jokes about it, but sometimes I wonder if he really means it. But, cosmetic dentistry is life-changing, and that's what people don't realize. And, it changes your smile is what everybody sees. And when you have that, you're proud of it. It's like the window to the world. And, I've just seen it time and time again, even this morning, it changes your whole life. So
Dr. Tanya, I want to give you a little nugget. Whenever people want to put down cosmetic or aesthetic dentistry, I normally tell them, listen, form follows function. And if I can get the physics of your teeth to look more harmonious and balanced and healthy, if I can get them to look healthier, naturally they're going to look better. We always know what looks good because we in our mind know when there's disease and that looks bad, and we know when things look healthy and that looks good. There's nothing wrong with something looking healthy and also looking aesthetic. If you want a more aesthetic smile, that's what the patient wants. And I want you to have better biomechanics and better physics and a more sound bite and everything. If we can apply both of those together, they end up with the same result. Giving you a cosmetic aesthetic result is only making you a healthier person. And really, after I tell that to people, they go, yeah, I do want that. It's kind of cool to
that's good, Todd.
Yeah.
That's really good. That's a really great way of phrasing that too.
I think once somebody just sees or experiences, has a family member or a friend, I've personally experienced it because I've never luckily had much of an issue with my teeth. However, there was a gentleman that I'm really good friends with, and he went and he had veneers done, and I asked him that. I'm like, why? Your teeth were fine. And I realized I had never seen him hardly smile at all. Wow. Until he received cosmetic dentistry, and now he smiles all the time.
Isn't that awesome?
It's beautiful. It's great.
That's a success story in and of itself, That's really cool. I love hearing like that. So,
hey, tell us, Dr. Tanya, about the skinny latte. Listen up, everyone.
So I love pumpkin spice lattes, and they're only around once a year. So we were in Toronto at the International Film Festival, and I only wanted to go there to see his movie, Mr. Rogers. So the opening of It's a Beautiful Day was in Toronto, and so when you go to the film festivals, all the actors are in town because they're all going to their openings, the world premieres, the red carpet. So I think I was I joke, but I really think I was the only non-famous person in Toronto that whole week. So I went into a coffee shop and they had a pumpkin with the words PSL in this big road sign on the sidewalk. So I knew that meant pumpkin spice latte. Anybody that likes those knows that's what that means. So I walked in there. I thought, wow, I haven't had one yet. So I walk in there and the gentleman in front of me said he was going to order a skinny version of a pumpkin spice latte. Well, they'll use like skim milk. And that's exactly what I thought. I'm like, I want that too. So I said, I'll have that too. And I turned around and it was Tom Hanks. So there you have it. So I think all the masses of people were totally like surrounding him and left. And I didn't do that. I wondered if I should have taken a selfie or something, but I didn't want to be one of those people. I don't know.
I would have so been those people. I'm
I
below
love
you.
I know.
Did you hear she got a little voipy right when she said Tom Hanks? Here's what I heard, Dr. Tanya. I heard Tom Hanks.
Yes, me too. Tom Hanks.
Well, my face was like deer with headlights. I'm like, whoop, that's Tom Hanks. I'm thinking, oh my God.
That is how excited I would be, though, if I ran into Tom Hanks. I think he's such a gem.
What is that movie with Julia Roberts where she goes into it is in the 90s and she goes in to buy the books from Hugh Grant or Hugh whatever.
Oh yeah, Notting Hill?
Yes.
Yeah,
it's like
Hill.
Everyone should know that, but I'm not a movie person. So, but it was kind of like that. You were, other than I guess you weren't working, but it was kind of like a normal person in a normal setting running across this person, but they kind of play it cool and yeah.
But I think I was playing it cool because I was stunned. I was shocked.
Yes.
Like I think I was still. That's why I played it cool. It wasn't intentional. I think I was just thinking, wait a minute, is this really happening?
You know what? It's probably the 10,000th time that's happened to them. So they just go, oh, they're cool shocked.
Yeah.
They have a word for it, I'm sure, or something like that. Yeah, they're cool shocked or something.
So my husband said, Tom Hanks was in there, and I'm just looking at him, and I thought, yeah, I know. I said, I know, we ordered the same drink. So it's funny.
So convert that to the movie Mr. Rogers, and Regan, you and I were talking with Dr. Tanya about the impact that Dr. Rogers, that Mr. Rogers has had on our society and our culture, and just the life lessons that we can take from there. Regan, what's your thoughts?
Oh, say that. I'm stuck swirling in Mr. Rogers. What do you mean, the life lessons that we can take from all of this?
Well, I suppose as if there's one or 1,000 to pick from, but have you seen the movie yet?
I have not seen the movie yet.
Oh, gotcha. Okay.
Oh, good.
No, I've not. Okay. Here's an admission of sorts. So I can't even get past watching the trailer without crying.
So good. It's a very cryable movie. And I think that the movie you cry for a couple reasons. One, because it's just a moment. But two, every single person in our generation has that memory. We all have a Mr. Rogers memory. Even if you didn't like it when you were little, you still have the memory. It brings you back. It brings everybody back. It makes you cry. So.
I started looking up videos of Fred Rogers on YouTube after this movie came out, and I will see the movie. I just kind of am waiting after the holidays so I can get through all the emotions of the holidays on top of it.
One emotion at a time.
Yeah, and this one interview, it was a particularly important one for me to hear because it was in the early 90s, and Fred Rogers said that he noticed that there was a lot of noise in the world and it was getting noisier, and that we as a society were really concerned about data, and we were placing a lot of important value on big data. And I was like, it was from 92, I think, and I haven't heard the
of
term
all things.
Yeah, big
92.
Data. Yeah,
right.
In 92. And his advice for us was to not to slow things down, but to be intentional, allow space. And Dr. Tanya talking about listening, I think would fit really well with that message. And so I put on Mr. Rogers for the kids a couple of nights ago and said, watch this with me. And I paid attention to what he was doing. And what he did was he left space for mistakes to happen. He didn't call them out. He was not deliberately fast, but he was intentional. And I think he focused a lot on how we relate to each other and the feelings that we have. So I feel that, through great dentistry happens with when you build relationships and you put down roots and you say, I'm dedicated to this community and I'm dedicating to caring for the people in this community. So that's my takeaway that involves Mr. Rogers. And I can see that Dr. Tanya and the doctors that you work with are very lucky to be with you, Tanya, and your community's lucky to have you.
Oh, that's so sweet. We love it for sure. I really can't. I would love to like have another follow-up phone call after you've seen the movie just to see what you think about it. It's so
deal. Well, we have another important question, Chad. Do you want to ask it?
I do. Dr. Tanya, you only get one or she knows. I can see it on her face. She's ready. I don't know. Maybe you don't. Maybe you do. Maybe you don't. Bacon or eggs?
Eggs.
Oh, hey, well, look at that. What's your favorite kind of eggs?
I love eggs. Scrambled eggs.
Scrambled eggs. With or without cheese?
You know, I have to tell you, every morning I make these little muffins and my kids, everybody eats one. So I put like little pieces of Canadian bacon, cheese, spinach. You bake them like a muffin, and that's breakfast every day for our family.
Hey.
Ooh, that sounds good and easy.
It's easy. You just microwave it. It's so good. You eat it in the car or while you're walking in. I love eggs. So
that's awesome. Well, you go enjoy your family time with the kids and stuff. We've got another eggs person. I'm circling that. And
can I tell you a funny story about eggs?
Yes.
So my license plates, I have a white car, and my license plates say I love eggs, but my children are Emma, Grace, and Sam. So I didn't realize it spelled out the word eggs. I just thought it was EGS. And so, so my license plates say I love eggs, but that wasn't the reason. It was really my kids' initials. So.
That's cute. I love it. I love eggs.
They don't. They're super embarrassed now that they're older. They don't want me pulling up and picking people. You know, they're like, you have a white car and people think you're a dairy farmer. I said, there's nothing wrong with that.
Yeah, no judge. We're in Illinois, you know.
Right. They're embarrassed now that they're teenagers, though, that my license plates say I love eggs.
Illinois anti-farmites.
You need to get a big vinyl yellow yoke and just stick it on the side of the car. As you ever pick them up from school or anything,
they don't like that. They don't want me to
keep your lab coat on and get a little yellow hat. Roll down the window with a spatula.
Funny.
We've never gone so far into depth into eggs. So thank you for taking us into that new dimension. But I'll tell you what, we've had a lot of good discussion. Maestro, the book by Peter Goldsworthy. We just touched on the fanciness of Mr. Rogers. And then also, you know, our plug, you and I, we can plug together. Everyone should check into joining the AACD. It's a spectacular group. And I have to admit, I was a skeptic at first when I talked with Marty Zase. And I was talking with him.
Marty.
Yes, he had crossed over to the AGD to give a lecture. And I was, big into the AGD first within my career. And so I emailed him and we had a long discussion. And I said, listen, I just don't like cosmetic dentistry sounds foo-foo-y. He's like, listen, I get that. Come to the meeting and you'll find that it's not foo-foo-y. And sure enough, when I went to the AACD meetings, I was very impressed with the high intensity of the continued ed, the stuff that wasn't even talked about in other places. You find out about implant stuff 5 years later on a local level than what the AACD is doing. You know, let's say in 2014, now it's coming to a local level to, you know, the cheaper local kind of CE. So it's just always amazing the kinds of stuff that AACD will talk about. It's not just about putting composite veneers on teeth. It's not just about, photography, even though it sure is about that. But the intensity on full mouth rehabs and everything and just how to bring it to the next level and how cool they are to share and mentor with you. The speakers, the people alongside you, the hands-on CE. I absolutely love the AACD. Dr. Tanya does too, and I just spoke for her. But yep, you better believe it that we do. So I encourage you to look up the American Academy of Cosmetics.
Who says that cosmetic dentistry is foo-foo? Did you think that?
I did.
Really?
Well, I did because I just thought I was just like, listen, cosmetic dentistry. Like, I get that dentistry should be aesthetic, but cosmetic sounds a little too.
I thought it sounds badass, Chad.
Well, I'm glad you did, but I had a hang up on it, and I really did. And I know that I'm not the only guy that thinks that or thought that, I should say. But after I went, I was like, okay, now I'm one of them because now I get it. And I really got it. And so that was kind of cool, like the paradigm shift, that at first I was kind of arms crossed, like, I don't know about this, but I suppose I'll go and check it out. And I was sold. The quality of CE, I mean, to have, Dr. Coyce speaking just right after, another big Dr. Garg, and then right after that, or in the next lecture hall, is someone else that's, just awesome, Coachman, just one after another of really cool guys, Spear talking about, so it really occlusion and form and function play into aesthetics. And so the better you are at both, the better you are at the other. The end. Everyone, thanks for joining us for Everyday Practices. We'll be looking forward to producing another podcast next week. So until then, hold your breath.
Bring your lunch or take us to the gym again next week to improve your everyday practices. Also, subscribe on iTunes, follow us on social media, and sign up for our email list. Now get out there and win with Everyday Practices.